Okay, so how does muscle activation work? Well, let's take a common condition that I see every day, low back pain. And what we'll do with the person the first time they walk in the door is we'll take them in, we'll do a complete history. We'll say, hey, what's your pain like? How bad is it? When did it first start? How long has it been going on? Do you have nervy symptoms? Blah, 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 blah. We're just going to get a really good history, good feel of what's going on. Then we will physically put you on the table, or you'll put yourself on the table. We'll have you in positions, and then we'll start to evaluate your spine. We may have you seated. We'll evaluate your joints to see how they're working. Okay, we always want to include joint function in our exam, and then for the muscle portion, what we're going to do is run you through a ton of muscle tests. So we'll put you in positions, and these are isometric tests, which means you don't move. Right? I put you in a position. You hold that position with all your strength. And it's really interesting. Sometimes you'll be able to hold it and sometimes you won't. These positions will define which muscles aren't working. Does that make sense? So we examine your erector spinae muscles of your back. That's with the big back straps on near your spine on either side. We're going to evaluate your glutes. We're going to evaluate your hip flexors. We're going to evaluate some of your quadriceps. We're going to evaluate your feet because your arches are important to your low back health. And so all these things gives us a picture. And what's interesting about the patient is that they can feel the muscle doesn't work, and so can the doctor. And so it makes it really nice. You don't have to take the doctor's word for it that it doesn't work. You can tell, the doctor can tell, it's really straightforward. Then we fix it. So depending on the amount of imbalances a person has, say in their low back or related to their low back, we start to fix that. So we take each and every muscle. Now every muscle has its own treatment. When I treat a muscle, it's a one-time fix. I usually don't have to go back and treat that muscle a second time. Now, there are instances where I do, but it's very rare. 95% of the time, that muscle gets treated and it holds. And that's because we're actually restoring a muscle from inhibited to working at its fullest capacity. Restoring, you see. We're not healing the body is getting back to its normal function. You don't realize it's been off its normal function for a long time. Restoring it back to there. So the body's like, oh yeah, the brain says, oh yeah, great. I remember how to do that, awesome. The patient can tell the difference, the doctor can tell the difference after the treatment. Now what does the treatment entail? Well, what we'll do is we'll first define which muscle we're going to treat. We'll say, okay, we're going to treat the multifidus muscle, that's a muscle of the low back. We're going to treat the multifidus muscle, and we're going to get it to lock in rock solid. So that entails going through pushing as close to the bone as possible on some of these connections. Really getting in there. It's uncomfortable. We'll push through those connections to the spine, to other parts of the spine. We'll adjust as a chiropractic adjustment or a manipulation to the spine, specific levels of the spine that relate to that muscle. And we do these other reflex points that relate a lot to acupuncture. So we'll push on these other points that may not even be near the muscle that help integrate a system that can affect the muscle. So the muscle can be affected by many different systems. And so in the treatment, we try to address all these systems, the organ gland system, the acupuncture system, the muscle connections themselves. And in this process, which takes about 5 minutes, maybe 10, depending on the size of the muscle, we get a muscle to lock in rock solid. The patient feels it, the doctor feels it, there's a significant change in strength, maybe even pain reduction. And we go from there. Then we move on to the next muscle. And what happens is the body, after a while, starts to get it, and other muscles that we don't even have to treat start turning on by themselves. So again, it all depends on the amount of breakdown in a person, say with the low back. But we just start fixing those muscles one by one. And once they are, turned on or activated, that person should feel the difference from that. The proof's in the pudding. They walk out the door. The next couple of days, they should start to get used to those muscles, and the body starts to move a little more free. And that's the treatment, and that's what people experience. So it's relatively immediate, the results. I think the results are felt over days. People can expect that. But again, it's a long-lasting therapy. It's effective, and that's the whole goal. So treatment of the muscle kind of entails that. That's a really simplistic way to explain it. But results are felt immediately, and I don't have to treat the same muscle twice.